The White House has rescinded a memo to reverse a federal grant freeze that sent America into confusion for 45 hours. The freeze caused widespread uncertainty among federal agencies and organizations that rely on federal funding, such as those in education, healthcare, environmental protection, and foreign aid. Trump defended the freeze, saying it was meant to allow a review of federal spending and eliminate what he deemed wasteful expenses.
We are merely looking at parts of the big bureaucracy where there has been tremendous waste and fraud and abuse. In that process, we identified and stopped $50 million being sent to Gaza to buy condoms for Hamas. 50 million. And you know what's happened to them? They've used them as a method of making bombs. How about that?
Several news outlets have fact-checked Trump's claims about condoms in Gaza and found no evidence to support his claims. CNN went so far as to dig up U.S. aid spending in the last 3 years under Biden and found there was no money spent on condoms for the entire Middle East during that time.
Let's talk about this some more with Dr. Vinn Pagtakhan. He is the founder and executive director of LoveYourself. That is a volunteer community that provides free HIV testing, counseling, and treatment here in the Philippines. Vinn, Dr. Vinn, is that how I should call you? Good evening, and thanks for joining us tonight.
Thank you, and good evening, ladies.
Thank you for... Right. We have been talking about the U.S. aid freeze for a while, but it was only last night when we chanced upon your statement on social media and how you guys are directly affected by this. Can you share with us again exactly how much U.S. aid you guys use in your operations? You mentioned some services will be affected, but not all. Go ahead.
Well, we tried our best to make sure all of the programs that we have are sustainable. So there was a bit of a misunderstanding in the statement that I released, because I mentioned that that none of our basic operations will be affected. So the free HIV testing, the treatment that we provide in all of the community centers that we have. So we have a total of 72 community centers all over the country. The testing of 250,000 people every year that we do, and the treatment for the 15,000 clients who are people living with HIV who are receiving treatment from us, it's going to be safe. So they are marked safe. So it's not affected by the sudden stop work order that we have. Unfortunately, the innovations that we have, so for example, the pre-exposure prophylaxis and the self-testing that we're providing, the deliveries of those interventions, we usually provide them for free for clients. Unfortunately, those are the support that are affected by the sudden stop work, and of course the human resources that's supporting those innovations. So right now all of those services are available still, but even if the services are available, if it comes with some cost, the number of reach scales down. So that's the most important thing that's happening that affects LoveYourself right now, scaling up the programs that we do. Unfortunately, while the government procures the medications and the test kits for the persons living with HIV and for those people who get themselves tested, innovations are not yet there. So when we introduce innovations, we do it through programs through international foreign aids, such as PEPFAR and USAID, and those are the things affected right now. But that is LoveYourself. We have so many community-based organizations all over the Philippines affected. We're just lucky that we came to a point that we are already self-sustaining, but there are organizations in Region 3, Region 4, Region 6 and 7, which are all part of USAID, PEPFAR, and CDC programs for HIV and sexual health program that had to close down and stop operation or cut down costs, and they tell their staff to not work for the next 90 days. So those are the organizations who are more affected by this stop work
Order.
Yeah, order. But
Order, yeah.
Vin, can we backtrack a bit? Did you get an email from the State Department with this stop work order? Because I have seen one organization similar to the work that you guys do. They posted actually a screenshot of that email. So that gave us an idea that, there is actually an actual email. Was it the same for you guys?
Yes. Yes, there was one email, but it didn't come from them. So because here in the Philippines, we do not receive direct funding from PEFPAR. So we have like prime recipient. So they're FHI 360. They're the international organization receiving for the Philippines. So they were the ones who sent us that starting yesterday, all of the activities will need to stop with no details whatsoever. So they're also uncertain of what's gonna happen. So it came as a shock to everyone that we had to stop everything that we're doing, the life-saving interventions that we're doing, we had to stop them. So Love Yourself had to set a step back and reassess our programs, because we used to send 700 to 1,500 free HIV test kits every day. So those things we have to step back and ask our clients, can they pay for the delivery fees, and even for pre-exposure prophylaxis, those are affected. Even much more are the organizations who rely 100% on the grants, because USAID PEFR EPIC project is a project that created several community centers that replicated the model of Love Yourself, wherein they do testing and treatment for free. Unfortunately, they are fully reliant on those grants. So they had to close down temporarily for the next 90 days. Hopefully, soon, I was advocating that I hope they could reconsider and reassess everything fast, because people's lives depend on it. South Africa, many countries that we partner with rely their procurement of ARVs through the USA PEFR. So they're more affected than the Philippines, because very fortunate Pilipinas, because the government, Department of Health, already procures the medicines for us.
Vin, I'm a bit confused because you said it is the stop work order that has affected your operations. But how about the money that goes into your organization? Is that not touched, or is it part of what's being frozen? Because President Trump, as you know, already rescinded the memorandum. So what is the status now? And when you say the stop work order has affected you, in what way has it paralyzed your organization?
So it didn't actually paralyze us. What it did was all the innovations that we're doing, we had to slow down, because everything that we do, we provide for free, right? So for example, the deliveries for the condoms, the lubricants, for the self-testing kits, and the PrEP, all of those had to pause, because we had to re-navigate how we could deliver them to the client. Should they agree to have delivery fees
is it because of labor, lacking labor? Kasi pag sinabing stop work order, yung tao yung apektado dyan, di ba? I mean, am I interpreting it correct?
Both po. So the deliveries, so the delivery fees are affected, and the people working to distribute and fulfill the orders are also asked to stop working. Yeah, so that's how it affects us, and as well as all the campaigns, the HR costs doing the campaigns and the digital mobilizing people to promote awareness. They had to stop working. They were asked to stop working for the next 90 days. Now, yes, there was a new update about that, but we haven't got any updates through our partners. So as of the moment, status quo pa rin kami from the last email. Kasi they were also asked not to report to work. So even people who are working here in the Philippines for FHI 360 and USAID were asked to not report muna. So talagang lahat kami clueless kung ano yung mangyayari. Even nag-retract sila ng a little bit, because yung very it's very unclear din yung retraction. Ang sabi ay support for treatment. Kaya lang kasi what we're getting here in the Philippines is mostly for prevention.
Right.
Yeah.
Vin, sorry, we're running out of time, but I wanted to squeeze in a last question. You talked about how the innovations moving forward had been affected. So we're talking about self-testing kits that may never be distributed, or you won't be able to do that anymore. the awareness campaigns. But give us an idea of how big an impact this might have on the Philippines. How many people might you not be catering to, and how big could the problem grow?
Well, just imagine we test 250,000 people every year. And among those 250,000, we gather around 1,500 to 1,800 newly diagnosed people living with HIV. And 20% of those clients come from our outreach programs through our self-testing. And moreover that, PrEP is the newest innovation that we have that actually has 99 to 100% effectivity rate when it comes to prevention of HIV. So it will actually halt yung prevention component na ginagawa natin imbis na we're helping stop the epidemic here in the Philippines. Talagang yung mga programang yun, magsuslow down sila. And, we need to actually scale it up and to slow it down when it needs to, go turbo at the moment will really affect what we're doing.